Development and maintenance of flexibility has long been a recommended component of health-related fitness. Flexibility is defined as range of motion of a joint or group of joints as per the skeletal muscles and not any external forces. The flexibility assessment protocols discussed for this video today will be the Canadian Trunk Forward Flexion Test, YMCA Sit and Reach Test, the Chair Sit and Reach Test, and the Thomas Test. The equipment needed for these protocols is a flexometer, a yardstick, a yoga mat, a ruler in centimeters and inches, a chair 17 inches high, and some tape. Before each assessment, it is required that you engage in a 5-minute aerobic warm-up. It is also recommended that the participant refrain from any fast, jerking movements. Few select flexibility exercises like a hamstring stretch should also be incorporated since the sit and reach test assesses hamstring, lower back, and hip joint flexibility. For the Canadian Trunk Forward Flexion Test, the client sits without shoes and the soles of the feet flat against the flexometer, the sit and reach box, at the 26 centimeter mark. The participant should slowly reach forward with both hands as far as possible. Exhale as you reach, holding this position approximately 2 seconds. It is very important that you ensure the knees are not bent while performing these protocols. Also, be sure that the participant keep the hands parallel and does not lead with one hand. Fingertips can be overlapped and should be in contact with the measuring portion or yardstick of the sit and reach box. The score is the most distant point in centimeters reached with the fingertips. Repeat the assessment and the best of 2 trials should be recorded. Because we used a sit and reach box that starts at the 23 centimeter mark, 3 centimeters should be deducted from the normative data tables used to classify each participant. My personal example will classify myself as fair due to my age of 33 and a target centimeter value of 25 centimeters. For the YMCA sit and reach test, begin by measuring about 10 to 12 inches apart so your heels of the feet should touch the edge of the taped line. Remove shoes for this assessment. A yardstick is placed on the floor between the legs and tape is placed across it at a right angle to the 15-inch mark. Ensure knees are not bent. Exhale as you reach. Hold for 2 seconds, making sure your fingers must touch the yardstick. Again, ensure do not lead with one hand and also repeat the exercise or assessment and get the best of the 2 trials. The score is the most distant point in inches reached with the fingertips. A normative data table should be used to categorize each individual based on each scores. My personal score, due to my age of 33, and score of 15 puts me in the average category. The chair sit and reach test is usually for older individuals who have a difficulty performing a sit and reach test because functional limitations prevent them from getting down to and up from the floor. Place chair against the wall to provide stability. Position yourself at the front of the chair. Extend one leg with the ankle dorsiflex 90 degrees. Keep the untested leg flat on the floor. Exhale when reaching forward and hold for 2 seconds. Scoring will be done in inches. If your toes are even or barely touching the toes, it is scored as a 0. If fingers go past the big toe, it is counted as a positive score, and vice versa. If there is a space between the big toe and the fingertips, it will be counted as a negative score in inches. A second person will be required to assist in holding the ruler and taking measurements. Important notes to keep in mind is to keep your head in a normal alignment. Both legs are scored individually, left and right, and there is no need to remove the shoes. The last protocol for this video is a Thomas test. The Thomas test assesses the flexibility of the hip flexors. These muscles tilt the pelvis anteriorly. Thus, an imbalance between these muscles and the hip flexors can negatively affect the functioning of the lower back. To begin this assessment, have the participant lie flat on the back or supine position. The participant brings one leg, the leg not being tested, in the direction of the chest, just to the point where the lumbar spine is snug to the floor or table. If the straight leg remains in contact with the mat, hip flexors of that leg are flexible. Make sure to assess flexibility for both left and right legs. If the tested leg rises, the hip flexors are likely to be inflexible. A second person will be needed to properly assess whether the score is a flexible or an inflexible test. And the final results will be classified as such for the participant. My personal results were flexible of both left and right legs of the Thomas test.